On-the-scene coverage of ACC.13 is supported by Janssen Pharmaceuticals, Incorporated.
We had new information here at the late-breaking clinical trials on the partner trial, two different components of it. Presented today were the 3-year results from the partners, part of the cohort that was the TAVR versus surgery, with the 3-year outcomes looking very, very good. Really identical outcomes between surgery and the either type of transapical or transfemoral placement of the percutaneous valve. They had an echo sub-study that looked very good, similar outcomes. And so I think this was very reassuring to me as someone who sends people down to the cath lab that the valves weren't falling apart after 3 years.
Yeah, I think it's really great data. Of course, the 1-year data from the study looked terrific, but a legitimate question that was raised is the procedure durable? Yeah. And I think the study shows out to 3 years, yes, TAVR is durable. Yeah. And that to clinicians should be a very, very reassuring signal. Yeah. In particular, I think the transfemoral approach is an appealing one. And of course, because of vascular disease, not every patient is eligible for that. But separate from this particular study, there was also a new trial, Partner 2, that examined a second generation or a next generation TAVR device that is lower profile. Okay. And what that study showed was compared to the older version, and in fact it wasn't really the older version, it was an improved older version. So this is almost a third generation device, that there was a reduction in vascular complications that was pretty large and pretty significant. And as you're aware, one of the big problems with TAVR is a lot of those patients are vasculopaths because they're older patients, calcific AS, lots of times significant peripheral atherosclerosis, especially in the iliacs and femorals, and that makes vascular access very tricky. But with this lower profile device, the complication rate came down quite substantially.
Well, that's terrific because, the notion of transapical is a little kind of, it's a big operation. You think, well, maybe if they can tolerate a transapical thing, why not just do the regular aortic valve replacement? But if then more people can have this new device, it's pretty amazing the number of people that get sent from all over New England to the Brigham, for this.
Right. So, I think we're at a really exciting time in TAVR where things are starting to take off. The technology is improving. There are further iterations of the technology, and I can imagine, based on data from the future, that there will be indication creep, but appropriate indication creep. So right now the major focus in clinical practice is on patients who are truly inoperable, but I can see that moving towards not just high-risk surgery patients, but moderate-risk patients. And those trials are ongoing and planned for a variety of devices, but the field's moving rapidly.
Yeah. So right now, if you wanted to do it, it's only if you're deemed inoperable by a surgeon that you're allowed to do this?
Yeah, so really it's the heart team approach where a surgeon, an interventionalist, and a general cardiologist have conferred and decided, yes, this patient truly is inoperable. Depending on the center, maybe even a couple of opinions from surgeons. And if a high-volume surgeon really thinks that this is risky, and preferably a team agrees with that, then TAVR can be considered in these inoperable patients. But the data ex-US are already pretty good, though not level 1A type evidence, that this is a good alternative for patients who might even be high or moderate risk for surgery.
Yeah. Oh, it's exciting. And, to see the 3-year results here, maybe that'll be reassuring, can open up some of those new indications.
I think so. A lot of times people don't realize that these valves have been tested on a benchtop. I don't mean the specific one being implanted in a person, but the models have been tested on a benchtop for fatigue, where they're opened and closed, thousands of times to make sure that they can last for a period of years, just as with surgical mechanical valves. And, that data obviously looked good before companies moved into humans. So there's good reason to think these should be durable.
Well, thanks for watching. I'm Chris Cannon here with Deepak Bhatt for On the Scene.